Welcome back. In this video, we'll engage in a role-playing scenario where we'll practice diagnosing and recommending treatment for a person exhibiting symptoms of depression and substance use disorder. Understanding how these two conditions coexist is crucial as they can complicate diagnosis and treatment. By the end of this video, you will be able to assess the individual symptoms, diagnose their condition, and recommend an appropriate treatment plan. Let's imagine a case scenario. You're a healthcare provider and you're meeting with Mark, a 35-year-old man who is seeking help for persistent sadness, lack of energy, and feeling disconnected from life. He reports that he's been feeling down for the last 6 months, but the symptoms have worsened over the past month. Mark tells you he has trouble getting out of bed in the mornings, finds it difficult to go to work, and has lost interest in activities he once enjoyed. He also reports frequent alcohol use, drinking several beers every night to unwind. Step 1. Assessing symptoms of depression and substance use. As you begin the assessment, you recognize that Mark's symptoms meet many of the criteria for depression: persistent low mood and lack of interest in things he used to enjoy, fatigue and difficulty concentrating, feelings of hopelessness and worthlessness, thoughts of death, though he denies any intention to harm himself. Mark's alcohol use is also concerning. He drinks daily, and although he insists it helps him relax, it's clear that his drinking has become a coping mechanism for his depression. His substance use may also be contributing to his worsening mood and is likely exacerbating his depression symptoms. Step 2. Diagnosis. Based on the information you've gathered, you diagnose Mark with depression and alcohol use disorder. It's important to note that depression and substance use disorder often co-occur. The interaction between the two conditions can make treatment more challenging, as alcohol can exacerbate the symptoms of depression, and depression can increase the urge to use substances as a form of self-medication. Step 3. Treatment recommendations. Now that we've diagnosed Mark, let's discuss treatment. Since Mark is struggling with both depression and alcohol use, an integrated treatment approach is needed. Here's a possible treatment plan. Pharmacological treatment. For depression, you recommend an SSRI, selective serotonin reuptake inhibitor, such as sertraline or fluoxetine, to help regulate mood. These medications can also help manage any anxiety Mark may be experiencing. For alcohol use disorder, motivational enhancement therapy, MET, could help Mark increase his motivation to reduce his drinking. A combination of medication like disulfiram, which discourages alcohol use by causing negative physical reactions, and therapy would be beneficial. Psychosocial interventions. Cognitive behavioral therapy, CBT. This is a cornerstone of treating depression. In CBT, Mark would work to identify and challenge negative thoughts and behaviors that contribute to both his depression and alcohol use. Mark might explore triggers for both his depressive episodes and his alcohol consumption, learning healthier coping strategies. Motivational interviewing, MI. Since Mark is ambivalent about his alcohol use, MI can help him build motivation to reduce his drinking. MI focuses on resolving ambivalence and encouraging self-efficacy. Support groups. You might also refer Mark to a 12-step program like Alcoholics Anonymous, AA, which offers social support and shared experiences with others struggling with alcohol use disorder. Follow-up care. Regular follow-ups are necessary to monitor Mark's progress, assess side effects of medication, and adjust treatment as needed. Encouraging him to continue therapy sessions and engage in healthy activities is crucial to his recovery. Reflection questions. How can alcohol use exacerbate symptoms of depression? Why is an integrated treatment approach important when managing both depression and substance use disorder? Now let's move on to our embedded knowledge quiz. We've covered a lot of ground in this video. To ensure you've absorbed the material, let's test your knowledge with some multiple choice questions and clinical vignettes. Remember, this is a great way to solidify your understanding and prepare for real-world applications. Question 1. Which of the following medications is most commonly prescribed as a first-line treatment for depression? A. Tricyclic antidepressants, TCAs. B. Selective serotonin reuptake inhibitors, SSRIs. C. Benzodiazepines. D. Antipsychotic medications. Answer: B. Selective serotonin reuptake inhibitors, SSRIs. Question 2. What is one major concern when treating depression in patients with alcohol use disorder? A. Alcohol consumption can interfere with the effectiveness of antidepressant medication. B. Alcohol consumption will reduce the effectiveness of therapy. C. Alcohol has no effect on depression treatment. D. Alcohol consumption causes cognitive impairment during therapy. Answer: A. Alcohol consumption can interfere with the effectiveness of antidepressant medication. Question 3. Which of the following therapies is most commonly used to help individuals with depression identify and challenge negative thought patterns? A. Motivational interviewing, MI. B. Cognitive behavioral therapy, CBT. C. Interpersonal psychotherapy, IPT. D. Family therapy. Answer: B. Cognitive behavioral therapy, CBT. Clinical vignette. 1. A 45-year-old male patient has been diagnosed with depression and substance use disorder. He reports feeling hopeless, lacking energy, and using alcohol daily to cope. His symptoms have worsened over the last 3 months. What would be the most effective treatment plan for this patient? A. SSRIs combined with CBT and motivational enhancement therapy, MET. B. TCAs combined with family therapy. C. Benzodiazepines for anxiety with CBT. D. Disulfiram for alcohol use disorder only. Answer: A. SSRIs combined with CBT and motivational enhancement therapy, MET. Clinical vignette. 2. A 30-year-old female presents with severe depression and reports that she has been drinking heavily for the past year to deal with stress. She has difficulty managing her daily life and feels increasingly isolated. What initial approach should be taken in her treatment? A. Start her on SSRIs and encourage psychotherapy with a focus on CBT. B. Prescribe antipsychotic medication for mood stabilization. C. Begin treatment with benzodiazepines to manage anxiety and depression. D. Recommend family therapy immediately without pharmacological intervention. Answer: A. Start her on SSRIs and encourage psychotherapy with a focus on CBT. Reflection questions. How can alcohol use exacerbate symptoms of depression? Why is an integrated treatment approach important when managing both depression and substance use disorder? This concludes the role-playing scenario and knowledge quiz. By engaging in role-play and reviewing the key concepts through quizzes, you can gain practical experience in diagnosing and treating individuals with depression and substance use disorder. In the next video, we'll focus on clinical vignettes that help solidify your understanding of treatment options and patient care. Keep it going, and I'll see you in the next one.